I'd like to welcome everyone today for part 2 of Getting Paid for the new Chronic Care Management Code. If you all recall, back in February, we shared how to provide the care that is required in the guidelines in the new management program authorized by CMS that took effect on January 1st. In this, we showed you how you can bill for the care that you are probably already providing for Medicare fee-for-service patients with 2 or more chronic conditions. Today, we will focus on how FITEL's Engage solution can help you get paid for the new CCM code. The presenter, Russell Olson, had a last-minute conflict this afternoon and wasn't able to join us. We do apologize. In his place, our colleague and product expert, Adam McCoy, will lead the presentation. Adam is a product owner at FITEL and has led several initiatives at FITEL. Some of these initiatives include FITEL's Meaningfully Used Stage 2 certification, PQRS, and patient engagement through multimodal communication. Adam completed his undergrad and graduate degree in economics and loves the analytical aspect of product management. Before we begin, I'd also like to share some exciting news. On Monday afternoon, IBM announced it has plans to acquire FITEL as part of the new IBM Watson Health unit. This acquisition will accelerate and extend FITEL's product roadmap relevant to clients' needs and provide more resources to help service them faster. We are extremely excited about this announcement and the positive impact that it will have on our clients. With that, let's get started. I'd like to review a few housekeeping items. Next slide, please. All right, first, we have a control panel on the right side of your screen. You can minimize or expand the panel by clicking on the arrow in the upper right-hand corner. Secondly, you can submit questions using the question panel located near the bottom of your screen. We will try to answer a few questions at the end of the presentation. If your question is not answered, we will have your account manager or sales executive in your region follow up with you after the event. Finally, all registrants will receive a copy of the presentation and a link to the recording within 48 hours after the webinar. This information will be sent to you in which you registered using the same email address that you registered for this webinar. At this time, I'll go ahead and turn it over to Adam. Adam, take it away.
Thank you, Renee. Welcome, everyone, to our webinar. As Renee mentioned, this is the second part of a 2-part webinar series on the Chronic Care Management Code. Part 1 of this webinar series was given by Dr. Hodak, Karen Handmaker, Marina Pascali, and Maureen McIntyre. In their presentation, they provided details about the Chronic Care Management Code and provided insights from Northeast Georgia's experience with meeting requirements for this new code. If you were unable to participate in this first webinar, I encourage you to watch the recording of the webinar at a later time. The recording can be found at the link shown at the bottom of the page. In our webinar today, we will focus on key operational aspects and available tools for meeting the CCM requirements. Additionally, we will discuss how you can use these operational tools in other initiatives. Apologize for that there. It clicked on the link. As we evaluate the CCM service requirements, we start to picture a Rube Goldberg device with numerous requirements, complexities, and caveats. Achieving these requirements and obtaining the financial payments, better care, and lower healthcare costs appear to be a near miraculous event. However, I think we can demystify the Rube Goldberg device. So to help us do that, let's walk through a high-level visual of what needs to happen. First, we need the CCM-eligible patients to book appointments. We need these patients in the office. FITEL's Outreach and Coordinate products are 2 very effective tools that can be used to identify your CCM-eligible patients and drive them to schedule an appointment. Once the patient attends their scheduled appointment, the patient will need to be introduced to the service, sign a consent form, and their authorization must be documented in a certified IT system. This initial step of obtaining and storing proper authorization becomes a catalyst for numerous items that need to be done. For example, we need to get the eligible patient enrolled in the program, maintain this enrollment each month that we want to build this code. We need to conduct care assessments that will result in a care plan. For the patient, we need to share this care plan with the patient, document in the certified IT system that the care plan was shared with the patient. Furthermore, we need to electronically share the clinical summary and care plan with other key care team members. We need to document these touch points and the time spent doing these actions. We need to manage the amount of time for each of these patients and identify patients that have not yet met the time requirement. All of these actions need to ultimately be properly documented in the billing system for the patients that have met the CCM service criteria. As we take a step back, we can see there is a lot of items that need to be done. We will not be able to discuss the nuances of each of these items in great detail today. However, I would like to focus on 3 components of CCM and care management. First, how do I manage the ongoing logistics of chronic care management? This includes the enrollment process, time tracking of actions, time reporting. For example, I will need to know which patients have not yet met the 20-minute requirement. I can then prioritize these patients and ensure that I don't miss the 20-minute criteria for a patient that already has 18 minutes. Effectively managing these ongoing logistical elements of CCM will play a significant role in your ability to successfully meet all of the criteria for your eligible patients. Second, how do I scale care management? So as the CCM services are performed by various members of the care team, how do we ensure that the care team is collaboratively working together? We need to know who is doing what and for how long they're doing it. Being able to effectively manage the actions across the members of the team will reduce duplicative work and help to ensure that some work does not slip through the cracks. Also, once we have the care team working in a collaborative way, how do we continue down that path by making it consistent and repeatable? And last, how do I ultimately show the values of these services? CCM is one step in care management, but how do I move beyond CCM? There are other initiatives such as employer or payer programs that we are working to achieve. How can I use these care management activities for other initiatives? Can we show that we are improving care and clinical outcomes for patients by following these care plans? And are these actions reducing the cost of care? So take a moment to imagine that there is a system that creates a care plan for every patient. I'm not saying that each of these patients or care plans are being actively managed by a process or a care team, but simply that each patient has a care plan from the system. There are technological advances that are allowing for this type of scalability of care management. But this scalability is opposed by 2 forces. First, scarcity. There are only so many care managers or care team members. There are only so many hours in the day, and there are so many demands on these resources. So we have to look to technology to help us overcome scarcity. We need technology to amplify the actions of the care team so we can check boxes within programs. But more importantly, improve the care and health of patients. Second, for those involved with care management, there is a very real awareness of a struggle between personalization and standardization. We know that changing behavior often requires this resource-intense personalized care. However, we also recognize that we need standardization for ROI purposes, reporting, and scalability. So we often feel this tangible tension between personalized care management and standardizations that enhance scalability. As we here at FITO have been researching and working to improve care management, we have identified ways to take this struggle and find synergies between these 2 elements. We want to show you this as we explore our Engage product. So let's return to managing the ongoing logistics of chronic care management. And let's focus specifically on enrollment and time tracking. We have structured Engage to be a system that manages the workflow of the care manager or the care pathways that patients will be guided down. So what you see here is an example of a program. We're on the programs page. This example program is called Cornerstone Program. Here you can see the Cornerstone Program listed here at the top. Let me digress here and provide some additional information about programs. A program structure facilitates the scalability component that we discussed earlier, as reporting is aggregated back to the program level. A program consists of various things. A program has modules. Modules contain actions, and actions contain steps. This hierarchy within programs provides great value as workflows are layered within the hierarchy. So let's take a deeper look at the enrollment functionality. When I click on the enrollment action, I am presented with the steps within this action. In this case, I can select the enrollment status and enter a start date. By quickly selecting enrolled, providing a start date, and clicking complete, I can see the enrollment information within the program attributes. I can see the start date, who the patient is assigned to, the eligibility status, and more. Much of this information was created behind the scenes. We're going to talk a little bit about this more later in the presentation. Let's consider the scenario where the patient wants to disenroll from the program. We can quickly return to the enrollment action and repeat the steps within this action. So we will select disenroll with the date and reason. When I click Save, all of this information is then updated within the program attributes, and any subsequent reporting for this program will reflect this change. This example demonstrates the tactical functionality required to manage enrollment at the personal level while maintaining the scalability that we need. We have developed a chronic care management module. This simple module contains a checklist of actions for all of the requirements necessary to be billed for the CCM code. So for example, has the patient received the agreement? Has the patient signed the agreement? Has this agreement been documented in the certified IT system? All this information is reportable within the program. So while many care team members may be involved with different actions, the module acts as a single CCM checklist for the patient. Let's move on to time tracking. In the previous webinar, we received a lot of feedback regarding time tracking. Many complained that their EHR lacked sufficient time tracking capability. Let me demonstrate how time tracking can easily be completed with Engage. At any time while in the program, I can access this quick add component that you see here. This allows me to quickly add a note for the patient. Within this note, I can select a type of touch point, which defaults to a successful phone communication. As shown in the detailed section, I can also add the duration of the call. Excuse me there. I can also add the duration of the call, which is then added towards the patient's 20-minute requirement. If the touch point was not a phone call, I can quickly update the touch point and add any specific notes that I would like. So any user can quickly add time for the appropriate services that they will count towards the patient's 20 minutes. All of this information is then available for reporting. Again, each of these touch points are the personalized aspect of the care management process. But the Engage product does more than just support these personalized touch points. It aggregates these touch points in the program for scalability and reporting needs, ultimately facilitating the CCM services and reporting on the progress made towards meeting these CCM requirements. So returning back to our second focus point, how do I scale? Let's continue to explore the Engage product, how the Engage product allows for scalability. I would like to focus on the repeatability aspect and team collaboration components of Engage. We have learned that each care manager has a slightly different view and approach for care management. These individual and unique approaches or care management activities are very personal and important to the care manager. Allowing for these personal approaches while trying to maintain consistency and follow evidence-based guidelines becomes very complex. However, the Engage product removes this complexity for both the care team and management needs. So again, we'll return back to the programs page with the Cornerstone program example. The program contains modules which contain actions, which contain steps. Let's look at this advanced directive action as an example. Engage allowed for the clients to create customized steps within the action. As one step is completed, subsequent steps will be presented based on the previous answer. This allows the care manager to easily navigate through the steps while focusing on the conversation and personal interaction with the patient. Let's take a look at one more module within this program, the medications module. This module has several actions, including a medication adherence action. A care team member will complete the medication adherence assessment by answering the questions displayed on the left. So when we started this program, for our example patient here, Jacqueline Adams, she did not have a care plan. However, as we completed the actions within the different program modules, a care plan was created behind the scenes. This seamless integration between the programs and the care plan is one of the key values of Engage. So think about the natural progression of a care team working through the actions of the program. These actions will automatically be creating and updating the care plan for the patient. As the care plan is being created and updated, it is doing so from predefined logic and templates. This creates incredible scalability. But these templates may not default to the exact task description that a care manager would like. As an example, you can see here that we have in our advanced directive goal here, we have a task that says provide copy of advanced directive to physicians. Well, that's a little general. Maybe the care manager wants to say, be a little bit more specific and personal here. So the care manager at this point can edit the task. They can go in and change the description to something like provide copy of advanced directives for Dr. Smith. So let me switch gears real quick and demonstrate how Engage can facilitate the collaborative work between care team members. In this example, I have selected an intervention. In this intervention, I can easily assign this intervention to another care team member. Each intervention is owned by a care team member and can easily be reassigned. I'd like to address the third item, which is how do we show value? This is a very large topic, so I will touch on two key ways to assess value in Engage. At a personal level, Engage provides a historical view of actions. So you can see here on the screen, I have a current, and then over on the right side, I have a history. And this historical view allows the user to go in and determine the progress at a personal patient level. They can see for this program, for this module, and for these actions, what the history is, where they currently are, and then assess the progress made. At a global level, Engage sits on top of a BI tool. This tool provides users with the ability to create ad hoc reporting on any data elements within Engage. The BI tool warrants a separate discussion on its full reporting capacity. Addressing the full scope of the reporting of the BI tool is outside of the scope of this webinar. However, this BI technology provides full control of reporting. So in summary, Phytel has effective tools that can be used to meet CCM requirements. Additionally, this tool can help you accomplish your care management initiatives. Thank you. This ends the presentation part of the webinar. Renee, I'll go ahead and turn the time over to you.
Okay, great. Thank you so much, Adam. Obviously, Engage is an important solution that we offer here at Phytel as it relates to getting paid for chronic care management code. With that being said, we are going to open it up for some questions. We're going to populate the queue here for a moment. Again, if you do have questions, and we're probably going to end actually early for everybody. So with that, for those questions we do not answer, we'll have either your sales representative follow up or your account manager. With that, see here, I think we have a couple of questions. Adam, I think there's one here for you if you want to go ahead and ask that question.
Sure, yes. So the question is this. Are these modules built in the tool, are these modules built in the CareFocus tools already? So the answer to that is yes, there are modules and programs already built within the tool. But let me explain that a little bit further. The existing programs can be modified or customized, if you will. In addition to that, the users can create their own programs with their own modules. So Phytel does provide a base or a base library of templates and programs with modules already that can be customized or added to. So we have a second question. Where are the specific CCM requirements reported? So this is a very good question. In regards to the BI tool that I mentioned before, that is the real venue for reporting for all of Engage. So all of the different data elements that you see within Engage are accessible via the BI tool. And within that BI tool, you can aggregate certain components. So for example, if you were looking to say, I want to see all of the patients that have at least 20 minutes documented, you could go in and aggregate up the different time components for each action, and in aggregate, those that would be above 20 would be your list. You could take each individual action and see the specific time element. So all of your data elements that are within the or that apply to the CCM requirements, all of those are accessible via the BI tool.
Okay, great. All right. Yeah. Go ahead, Adam. You can go ahead and.
Yep. Hold on, real quick. Let me read this question here.
Sure.
So, very good question. The question is, does Engage interface with EHRs? So problems, meds, etc. don't have to be entered in both. So, very good question. The answer to that is yes. And so, similar to other Phytel products, we can integrate with your EHR and pull that data in so that we can have that within Engage.
All right. Actually, that will conclude all of the questions that we have in the queue at this time. Did you receive any other ones individually?
I have not yet.
Okay. We'll just wait one more minute and see if any other questions come through. Adam, if you can go ahead and go to the next slide. In the meantime, I'll go ahead and let everybody know. If you do have any questions, feel free to reach out to Russell Olson, again, VP of Innovation and Product Management here at Phytel, Adam, or myself. I do want to let everybody know that we are having another executive webinar on Wednesday, April 29th from 12:30 to 1:30 p.m. Eastern Time. It is on using automated campaigns to educate, support, and coach your whole population. And Mr. Terry Coleman, who is the practice administrator at Charlton Internal Medicine, will be presenting that presentation. And actually, Adam, I believe you are also moderating that session as well. So feel free, great. So feel free to register for that event too, coming up in a week or so. with that, I believe we do not have any more questions at this time. So we want to thank everybody for your time today. We're going to conclude a little bit early, and if there are any other follow-up questions, please feel free to, again, reach out to us individually, or we'll have your sales representative and or account manager follow up. Thank you again, everybody, for your time today. This concludes the webinar.